The other top story that we are tracking are the latest of the ICMR guidelines, which talk about how there is no test needed if you are asymptomatic. No test needed if you are traveling domestic. No test needed unless you are coming in from an at-risk country. In fact, no test needed even if you come in contact with a positive person. Basically saying that unless you yourself are a high-risk person, somebody who's older, somebody who has comorbidities or taking treatment or recovering from a life-threatening disease, there is no need to get tested. These new guidelines have come in from ICMR as India is battling a third wave of the pandemic. But does no test also mean no isolation? Well, that's something that we've been talking about all morning. And let's get a bit more clarity on this from our panel now. Joining us this afternoon, we've got Dr. Aviral Roy, Director, Department of Emergency Medicine in Kolkata. He also is joined by Dr. Parekh. He's a physician and author of the coronavirus book. Also with us is Dr. Sushila Kataria, and she's the Director and Head of Internal Medicine Department at the Medicity, Medanta. Dr. Roy, if I can begin by getting your opinion and perhaps if you have more clarity on this. We've been looking at guidelines that came in, and the detailed guideline ran into several pages from ICMR last evening. It said don't test. Doesn't tell you whether you need to isolate. And this question comes even more to prominence since the news came in this morning of how the entire top brass of the BJP in Uttar Pradesh actually was in one room, all with masks, mind you, but in one room, sitting close to each other, and they had a meeting. One person tested positive, which is the BJP chief there, but surrounding him is the chief minister, several other leaders, like I said, the top brass of the BJP there in UP, but all of them are out campaigning, back at work. Is that risky, not risky? Just want to get your thoughts on that.
Thank you. So it's a great question. And let me ask you by asking you a counter question. If there's a fire and you don't have a fire alarm, how are you even going to get the fire engine to the site of the fire? So at some point, the government has realized the number of cases is just too high. And with the number of people going into isolation, they are just not able to provide essential or basic services. So at some point, they've realized, you know what, unless you are somebody who's high risk, there's no point testing you, no point really. If you are asymptomatic, it's okay, come to work. It's a strategy born out of probable necessity and desperation, but the counterpoint being you will never have any control on this virus now. It's just going to go rampant until you have a large number of your population actively falling sick, and that people are not going to listen to you at that point, and they'll go ahead and test. Is it the safe thing to do, and is it the medically the right thing to do? Probably not. But the ICMR, as we know, not only looks at medical guidelines, but also probably logistical problems as well as problems with ensuring the community is running. But from a scientific point of view, it may not necessarily be the most scientifically sound basis or the most scientifically sound advice to, so if somebody is a high risk exposure.
So what you're suggesting is that this could be used, say, for essential services, for nursing staff, for doctors, for police services, for everybody else, but it shouldn't have ideally been put in as a blanket rule across the country.
You're absolutely right. So like even for healthcare workers, we saw the fact that even if they got sick, if they were 5 days in their asymptomatic, you're anyways asking them to come back. So if you're asymptomatic, you're a healthcare or an essential worker or frontline worker, and your absence puts a major toll on the system, then this might make some amount of sense. But if you're a general lay person, you do not know what's going on, you are exposed to COVID patient, you have high risk people at home that you could possibly be infected, and then go and expose your high risk patients at home just because you don't know what your status is and their official guideline is not to get tested. You could potentially put a lot of people at risk who don't necessarily need to be put at risk.
Right. Dr. Aviral, you're echoing the thoughts of so many people and you know how they also looked at these guidelines, but just want to get in a technicality over here, and if Dr. Sushila can lay it out for us. When ICMR says that there is going to be no testing, it doesn't talk about isolation. Is that something you have clarity on? Should you still, under the government guidelines, be isolating but not testing? Is that how we're supposed to see this?
No, I don't think so. They say this. People do not honestly actually isolate even when they're tested positive if they're asymptomatic. So expecting somebody to be asymptomatic and isolating very honestly and judiciously, that is next to impossible. So I think at this stage, what the ICMR says is that they have accepted there is a rampant community transmission, and the pandemic will take its own shape. So let it be, let it go the way it wants to go. Obviously, practical aspects and logistic aspects are there, but I don't think testing hurts anyone. I have always been an advocate of, extensive testing, and at least, that's where we can control it to some extent. We cannot, in 21st century, we cannot let the pandemic have its own natural course.
Right. Right. And, this is in contrast to what WHO is saying as well. They're saying test, test and test, know it, detect it, go ahead and try and track these cases as well. But this is quite in contrast to that. But Dr. Sushila, could you share with us how Medanta, for example, is operating? Are you asking people who've been in contact with positive patients or positive doctors, are you asking them to isolate?
See, what we have done is a practical approach that everybody masking all the times, and we do not allow people to have meals together, one. And masking of the hospital staff is must all times. So if somebody gets tested positive, earlier we were giving like 10 days off, now we're giving 7 days, which can further be reduced to 5 days if they're symptomatically better. As far as the contacts are going, and as most of our staff is fully vaccinated, we test them on the 3rd day, but because of the scarcity of staff, we let them continue with the work with, double precautions of mask and all that. But it is not possible to give rest to everyone who's come in contact, because it is a hospital scenario. People will come in contact. But we are testing, and obviously we are making sure that they are not serving in the most vulnerable areas. And
so just to get that correct, you're saying if you test positive, then you are asked to isolate for at least 7 days. If you can return to work earlier, even better, works for the hospital. But if you have been in touch with somebody positive, currently in Medanta, and I've been hearing the same thing from several other hospitals, not just in Delhi, but outside as well, you are not isolating. Is that correct?
Yes, we are not isolating if they are not symptomatic, one. Secondly, if they are fully vaccinated. And thirdly, we try to find out the extent of exposure, like a casual contact. I passed on the sides of this person who was positive. This is not a significant contact. The significant would be at least 15 minutes without mask by both the people. So in all these patients which are,
I see. 15 minutes without mask in contact with somebody who has tested positive, you will isolate them. That's what you're telling me.
Ji.
All right, good. Can I get a quick update from Dr. Roy on the same thing? How's it looking like in your hospital in terms of protocol?
So we are doing something similar because, as I'm sure you are aware, a lot of hospitals are facing significant staffing crunches. So if they are asymptomatic, and even if they've had if they've had just passing contact, they continue to come to work. If there is a major contact and they are asymptomatic, they continue to come to work. If they are symptomatic, then they do get tested. If they do test positive, but they recover and within 5 days, they are now asymptomatic, we ask them to come back to work. Basically, they have to be asymptomatic for a period of 48 hours. And once that passes, we do allow them to come back to work. If we were to isolate every single person who comes in contact with a positive patient.
Before the guidelines came in as well?
Pardon me?
Were you undergoing this protocol before the guidelines came in last evening?
Yes, we were going it prior to the onset of these guidelines, because if we were to go with the prior set of guidelines, which recommended 14 days isolation for every COVID positive patient, there'd be absolutely no way to run a hospital or for that matter, any essential service.
I understand that. Dr. Parekh, then how do you see this? I understand when these protocols or perhaps these guidelines are enforced in this manner because there are essential services. These are doctors, nurses, police people, even media, for example, where this has been imposed. But would you say the urgency is the same for, say, politicians?
I'm unfortunately not a political scientist. I'm a clinical scientist. So I'll stick to
let me ask you this way. Let me ask you this way. Politicians' average age in the country, mostly would be above 60, right? So in that at-risk group, would you say it's advisable for them in this not defined, very clearly defined guideline in the ICMR report? Would you say it's advisable for them to go out, to do door-to-door campaigning, travel and meet people if they've been in touch, in close contact with somebody who has tested positive?
So just to clarify something, the ICMR document we're referring to is titled Advisory on Purposive Testing Strategy. It's specifically a document for the testing strategy. There are separate documents for isolation, which is for individuals who are symptomatic and or have tested positive. Separate documents for individuals who need to quarantine. That's individuals who are asymptomatic.
I'm very glad you brought that up. I'm very glad. I'm sorry I'm interrupting because it's just a piece of information I want viewers to see as well. Because there are isolation rules which actually come out from Health Ministry, we are told. My colleague Parimal made that clarification a little earlier, saying that according to the Health Ministry guidelines, an asymptomatic contact of a person who has tested positive will need to isolate. So are we to see that in tandem with the ICMR guidelines?
So the ICMR document is an advisory document. The ICMR puts out advice that various organizations can choose to implement and modify in a way that suits their local situation. What we have to remember is when we're talking about this exposure, you have to keep in mind that, yes, while we are saying that, okay, someone who has had a confirmed close contact with someone, the vast majority of people who are infected right now are not getting tested. And community prevalence is so high that if you are just going out and living your life, you are exposed. You are getting exposed. The chances of interfacing with someone in a metro like in Mumbai or Delhi with the levels of infection, the level of transmission right now, your chances of being exposed to someone in your everyday life are very high. So there's a certain amount of pragmatism that comes with this. But one thing that is missing here is a little bit of nuance. So we are right now talking about risk to the individual when they are exposed. What we also need to consider is risk to their secondary contacts. So, for example, if you live with people who are fully vaccinated and healthy, your situation is very different than if you live with someone who's elderly and immune compromised. That individual who's living for caring with an immunocompromised individual should ideally test, because that is then preventing them from passing something on to their relative who might get sick. If you're a healthcare worker who is caring for immune compromised, for example, individuals who've done a bone marrow transplantation, or hematological malignancies, then your context is very different, because the consequences of you transmitting to them could be devastating. So I think there's a certain amount of nuance that we need to put into testing strategies. Important, even if you look at the process for ending isolation. So whether it's home isolation or whether it's ending isolation from a center, when you take that decision, that we're not going to test someone and we're going to release them at day 7 if their symptoms are resolving or have resolved, you have to also consider what is the consequence of the residual transmission risk. So are they going back to a home where they live with someone who has cancer? Because if that's the case, you absolutely should test them, at least with an antigen test. To make sure they're not infectious.
Don't take it. I think the sense I'm getting from all of you is don't take it as a blanket advisory. Apply your own mind when it comes to it. Your circumstances might be different when it comes to this. And just going back to what Dr. Roy was also saying, that this is something which is medically not very sound, but perhaps pragmatism at the moment has compelled the government to come out with these guidelines. That's all the time we have. Thank you so much for joining us.